I think we're in dire straits.
Staffing shortages at the province's hospitals continue to worsen. Manitoba's largest hospital, Health Sciences Centre, has confirmed that they have started to call in paramedics to help out in the emergency room. It's a never-ending problem. Staffing shortages in hospitals across Manitoba remain a major issue. Now the problem is taking one step further. Paramedics are being called to fill in the gaps.
I'm not surprised. We are in a critical nursing shortage, and we are in desperate times right now in our ERs at HSC.
Manitoba Nurses Union President Darlene Jackson says HSC is at times running with 10 to 12 nurses short on a shift. This is why paramedics are being called in to assist. But Jackson says she's also not surprised that no paramedics were available this past weekend to work.
They are as overworked as the workload is as heavy for them. They are as burnt out and as exhausted as nurses in the system are. So I'm really not surprised that we didn't see a big uptake in that request.
Jackson says the call out for paramedic support shows how bad the situation in hospitals is. On Monday, Dr. Sean Young from HSC said paramedics are a great resource to help out nurses in the emergency department.
We've been looking at this for years. This is our opportunity to actually maybe make it happen more permanently. But I don't know what those schedules will look like. The weekends are definitely an opportunity for us because that is when some of the trauma is at its worst and some of our needs are at its greatest.
Young confirmed that Grace Hospital is also taking in paramedics for assistance.
It's a routine practice in Manitoba. We just started making it more operational as of this weekend.
But Bob Moreau's president of the Manitoba Association of Healthcare Professionals says it's not routine at all. He says there aren't enough paramedics as it is, and adding this workload will lead to burnout. Quote, rural paramedics are up to 40% short in some areas, and Winnipeg response times are also going up according to recent reports. Staffing ERs with paramedics doesn't seem like a sustainable or well thought out plan. To me, it sounds more like they are scrambling. The province has announced programs to train more nurses, but Jackson says this is a long-term solution and says the province needs to act now.
I think that we're going to be even in bigger trouble, and we're going to see even more of a bleed. So I think that they need to really start talking very, very quickly about what it's going to take to retain nurses and what it's going to take to draw nurses back from those private agencies into the public system.
In Winnipeg, Alex Karpa, City News.